Was there a time when if somebody reported a medication error that there was fear that they'd be treated in one way or another?
Sadly, we still have state boards of pharmacy and medicine and nursing that when an error gets reported by a consumer, their focus is on the health professional, and they invoke punishments, disciplinary action. Unprofessional conduct is a common charge that we hear about when a pharmacist was working, for example, in a community pharmacy under incredible pressure, trying to do the job as best they can, not being properly staffed, numerous interruptions with the telephone going off, poorly supported with only one technician, no dispensing technology, like robotics, and they're expected to perform with perfection, and it doesn't happen. And they make an error, and a consumer reports it, and they're brought before the board, and they're just not doing us any good by the way that they're acting, because what they should be doing is going back to the management of the pharmacy, the ownership of the pharmacy, and looking at the systems that allow that pharmacist to make that dispensing error. And you will find they are numerous. The way drugs were stored, the fact that they don't have technology, or we're allowing technology to be misused. We have barcoding installed in pharmacies, and I have been asked to go in and look at systems in pharmacies, and one of the first things you find is, you know how they enter orders for a drug? They have a piece of cardboard, and they've taken the labels off of containers, and they paste the label on the cardboard. So in order to enter the drug, they scan the cardboard. They never scan the actual bottle, which is what they're pouring into the container. So if they pick up the wrong bottle, it doesn't get caught. How can a supervisor allow that to happen? So these are the kinds of things. Where are the supervisors? Why aren't they going into community pharmacy? I'm talking about community pharmacy, and I realize this is health system. I hear this all the time where they're looking more at the metrics. How many prescriptions were filled in what amount of time? How many patients, did they serve within 15 minutes? They were even giving out coupons, one of the chains. If they didn't fill 3 prescriptions in 15 minutes, you got a $10 coupon or whatever it was. That's absurd, because it puts incredible pressure on the staff, to get that done, and to meet their metrics. And when they don't meet their metrics, they could be in jeopardy. Their supervisor comes in, that's what they look like. They're not coming in and saying, here's what ISMP had in their newsletter last week. Do we have this problem here? What kinds of things are you doing? That is not done. So, people talk about safety. The state boards let this go on and on and on. And I'm not any state board. They perform a very important function. But, there's a lot of omissions in safety that they should be very much concerned about. That would definitely be one of them.